Hello, I'm Jason Howland, and welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You know, ADHD affects millions of American children, and its diagnosis can be scary. Its symptoms also a challenge for parents and their kids. However, treatment is available and can make the difference in children with ADHD growing up to be normal adults. Here to tell us more about ADHD today is Anita Handevidt. She is a certified clinical nurse specialist in psychiatry and mental health from Mayo Clinic Health System. Thanks for joining us, Anita.
Thanks for having me.
Well, before we get into the heart of today's topic of ADHD, let's talk a little bit about you. You are a certified clinical nurse specialist in psychiatry and mental health. What's the difference between what you do and a psychiatrist or psychologist?
Well, I'm a registered nurse, essentially with advanced training, essentially a master's degree, and I am trained to do assessments and diagnosing, and I can prescribe medication to my patients. A psychiatrist is a medical doctor who specializes in psychiatry, and he or she also diagnoses and prescribes medication. A psychologist also assesses and diagnoses but is unable to prescribe medication.
So as a clinical nurse specialist, you can prescribe meds just like a psychiatrist then?
I can. Maybe the difference might be the psychiatrist might have a little more training or more training in the neuropsychiatry or the way the brain works and operates.
So are you from South Central Minnesota, and have you been practicing in the area for some time?
Yes, I was born and raised in the Jackson area, and I have been practicing nursing in this area for over 30 years. I've specialized in mental health for probably the past 13 years.
And can a patient, can they set up an appointment to see you directly, or generally are they referred to you?
Well, both. I do get referrals from other physicians and nurse practitioners. I also get referrals from county social workers, other mental health practitioners in the area. Patients can also directly call our department and set up appointments for an assessment.
What are some of the mental health issues that you help people with? We're talking about ADHD, but I know there are a myriad of mental health issues you help patients with.
I do work with most of the mental health issues or diagnoses. A lot of the common ones that I see include anxiety and obsessive compulsive disorder, depression, schizophrenia, bipolar disorder. Also see people with post-traumatic stress disorder along with ADHD. I also see people with dementia and the autism spectrum disorders.
Well, today we are talking about ADHD. First of all, what exactly is ADHD? Is it different from ADD? Because I've heard of ADD too.
We used to differentiate ADHD in two ways, ADD or ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder, and commonly people think of hyperactivity when they think of ADHD. More recently, the diagnosis is all encompassing as ADHD, either inattentive type or hyperactive type or combined type. It's a common condition that affects millions of children, as you've already spoken to, and actually adults are affected too because you don't grow out of ADHD. Our ADHD usually affects children early on, and there's between 4% and 12% of school-age children are affected with attention problems.
Wow, that's a lot of kids.
It is. It's a pretty common diagnosis. Generally, it becomes evident in early grade school, sometimes even earlier, and it continues into adulthood, as I mentioned before. Inattentiveness, hyperactivity, and impulsive behavior are hallmarks of ADHD, and specifically, sometimes children, if they're hyperactive, they act as if they're driven by a motor, or they make a lot of noise, they can talk excessively, they fail to pay attention. Inattentive symptoms manifest themselves more as daydreaming, kind of being distracted, not listening, and there are just a lot of different symptoms. These children that have ADHD often struggle with low self-esteem. They have trouble academically in school and behaviorally. And sometimes they don't get along with other kids, and it can also affect the family life as well. So there are several different types, as I mentioned, that have been identified, and that including the hyperactive type, the inattentive type, and the combined type. There's also subtypes that aren't labeled quite yet. Sometimes ADHD can also have alongside it anxiety disorders or depression as well.
So I got to be honest with you. A lot of the symptoms that you talk about for both inattentive and hyperactive, they sound just like the way healthy kids can sometimes behave, easily distracted, forgetful, daydreaming, restless, or lots of energy. When should a parent suspect it might actually be ADHD, and then what should they do?
When they become problematic, when it affects academics in school, if there's behavioral issues and trouble interacting with teachers and their peers, or if there's a lot of problems in the family life. It's interfering with quality of life. These symptoms should have been present for over 6 months. Sometimes normal life events can cause some of these symptoms, and of course that the underlying events or precipitating events have to be ruled out first. But normally, if these symptoms have been present for over 6 months and it's interfering with a child's quality of life, it needs to be addressed.
So it sounds like if it's really affecting relationships, whether it's with other kids or the teacher or even the parents, and it's lasting for a prolonged period, then it definitely could be ADHD, right?
That's correct.
If a parent does suspect perhaps that their child may have ADHD, should they make an appointment to see someone like you first, or should they go to their family doctor or pediatrician? Or
Well, it's recommended that they see their family doctor or pediatrician first to rule out any medical or physical problems. It's rare that these symptoms are caused by physical problems, but they're occasionally thyroid problems can be have caused some of these behaviors. Maybe some other blood disorder might cause similar symptoms.
so let's say it's not another cause like that, like thyroid or a blood disorder. What does cause ADHD in children?
Well, it's not really known what causes ADHD. That's still being studied. ADHD is one of the most commonly and frequently studied disorders in mental health. It's important to understand that it has nothing to do with intelligence or being lazy or lacking self-control or not trying hard enough. The brain works differently in ADHD. There's a lower level of activity in the front part of the brain that causes these symptoms to erupt. The impulsivity, the inattentiveness, the front part of the brain just is not working for the child the way it should, and causing these symptoms. ADHD can also be hereditary. Actually, it's very hereditary. And other causes that they've identified that increase the likelihood of developing ADHD is exposure to toxins during pregnancy, like alcohol, other drugs, and other toxins. And they've also correlated exposure to toxins in childhood, possibly insecticides or other substances that are harmful.
So Anita, you talked about it can be hereditary sometimes, and oftentimes it is. Do you find that it comes from the father or mother most, or grandfather, grandmother, or does it not matter as long as it's a family member?
Generally, it's first generation. It's inherited through the parents, who may have inherited it through their parents. I always tell parents who bring their children in that when I see a child with ADHD, there's usually a parent with ADHD. And often, too, it's interesting when parents bring their children in to be evaluated or treated for ADHD, parents start looking at their own behaviors and symptoms, and then they end up asking for treatment if they haven't been already.
Sure, because I would imagine, a generation ago, it just wasn't diagnosed as much.
No. We don't know if it wasn't diagnosed as much, or another theory is that persons that have ADHD are having children who are having children who are having children, and it's inherited that way.
So how can ADHD be treated then?
Well, there's really no cure for ADHD. Once you have ADHD, you'll always have ADHD. Treatments are very effective, and it includes behavioral therapy, in which parents are trained and worked with, along with the children are also given behavioral therapy to help them understand their illness, or the syndrome, and how they can cope with behavioral techniques. Medication is very effective. It's a brain problem, and medicating the front part of the brain, stimulating the front part of the brain, often helps most of those symptoms resolve or disappear during the time that they're treated. Learning strategies are good, learning different coping medications. Teamwork is really important among parents, the teachers, and their healthcare professionals to come up with a treatment plan for the child, especially during the school years. As a child gets older and goes into college and then on into an occupation or career that they enjoy, those symptoms seem to go away. But actually, it's because the child has learned to adapt, or the person has learned to adapt, and they're also in a career that they enjoy.
When you talk about learning techniques, learning strategies, give me an example of that. What's an example of a learning strategy?
Keeping lists. Persons that have ADHD need to have a very structured environment, so having planners and calendars and lists are very helpful. Consistent routines are important. Consistent parenting is important. Sometimes using a reward and consequence approach helps younger children. These children don't mean to be naughty or impulsive, and their brains can be retrained somewhat to be able to interact or respond in an appropriate way.
So Anita, as a professional, do you believe medication is the answer, or is therapy, certain skills training, or other alternative methods the answer?
Well, I believe in a combination of all of the above, but since I'm a prescriber, I do believe in the effectiveness of medication because it's a physical or organic illness, and medication really helps. But some of the other things that are important too as well are just the structures we talked about a few minutes ago. Parents need to be patient and understand that these behaviors aren't done on purpose. Showing lots of affection to your child helps with the self-esteem, keeping things in perspective. It's very important to keep a regular schedule, provide structure for your child. Timeouts and the reward and consequences type of discipline is important. Being rested, having a good diet is important. There is no special dietary treatment for ADHD. There's a lot of media and advertisements out there for special supplements and diets for ADHD, but these have been proven to be ineffective or not that helpful. It's important to have protein in the diet and have overall a well-balanced diet for a child who has ADHD as it is for everyone else. Restricting caffeine or sugar also has not been proven to, one way or the other, affect ADHD. Communication with the child's teacher is essential, and getting involved in some of the school programs where the school can help the child academically as well is very important.
Well, unfortunately, there's so much more we could talk about, but that's all the time we have. I'd like to thank our guest today, Anita Handevidt, certified clinical nurse specialist in psychiatry and mental health for Mayo Clinic Health System, for joining us today. Thanks for joining us.
Thank you.
And to make an appointment with Anita, you can call 507-238-8598. Thanks for joining us today on Speaking of Health. Have a great day and be healthy.